Hi, everybody. My name is Rizwan Chaudhry, and I'm your host for episode 2 of a brand new podcast called Organoids and a Large Portion of Chips, brought to you by the WORC.Community. And we'll be talking all things organoids and organoid chip. And if you've missed episode 1, check out your favorite podcast provider and look out for episode 1. So, first of all, I want to welcome my regular guests here and experts, Professor Marianna de, who is the head of
Hello.
urology. Yeah, you should say hello, Mario. Yeah, lovely to see you. Who is the head of Urology Research Laboratory, Department of Urology and Department of Biomedical Research, Director of Translational Organoid Resource, Associate Member NCCR RNA Disease at the University of Bern. So, Mariana, hi, how are
Yes,
you?
good. I am
Right.
fantastic. How are you doing?
Very, very well. And also, our other regular guest, Professor Stephen Ray Wilson from Department of Chemistry, University of Oslo, I should say. And our special guest today, Professor Thomas Hartung from the Johns Hopkins Bloomberg School of Public Health. And Thomas has helped steer the revolution in toxicology to move away from the 50-plus-year-old animal tests to organoid cultures and the use of artificial intelligence. And someone told me that, Thomas, as you can tell. But it's lovely to meet you, and thank you for getting up so early to join us this morning. It's 6 a.m. where you are in the morning, where you are calling in from. So thank you for joining us this morning.
Yeah. Good morning or hello, everyone. Thanks for
Right.
having me.
It's lovely for you to join us. Now, today we're going to be talking about ethics, but before we do that, Marianna and Stephen, who joined us last month, you were on your travels or talking about all the different things that you're going to be visiting. So, how was the last month for you, Marianna? Maybe we can kick off with you. So, I know you went to the various events. Anything exciting happen? Any high point, low points in terms of organoids news and information that you'd like to share?
Well, thanks for asking because I think I've been on a meeting tour in the last month, I would say. I've been at this wonderful meeting at URS at Yale Medical School where there's a lot of people. The technologies of organoids and spatial transcriptomics are really advancing in the urological research. Then I was at the AACR pancreatic meeting where there's also there a lot of on-chip technology going, which is also quite exciting there as well. And then I've been at a meeting in Switzerland, or the bladder cancer meeting, which I must say was really state of the art. And there we presented our clinical trial in which we predict treatment of patients in non-muscle invasive bladder cancer. And the results, I must say, are more than what I actually hoped for. So I'm really looking forward to the recruitment of the last patients and the follow-ups. And finally, I was in this wonderful meeting in Rome, which was a organoid workshop where I must say it was very challenging. Although I am Italian, all of a sudden I was faced with scientific Italian, which was, kind of another language for me. So I ended up speaking English with my Italian colleagues, which was just bizarre, I would say. And the one of the organizers, Giovanni Blandino, which is a fantastic MD and scientist that is in Rome, he's working on also on organoids, and they have really taken a very big step forward also there in muscle invasive and non-muscle invasive bladder cancer. And the most important part is the fact that everybody was so collaborative, and really we're going to start working together. And so I hope to bring them also at our meeting in Cambridge. So that would be fantastic to see the different aspect of it as well.
That's
So yeah, I
fantastic.
had a great time, just a little jet lagged, but you know.
And Stephen, how about you then? Because I know again you were going to be going to a few talks and
Yeah,
events as well.
yeah. So I've been also a bit around, but I would say that my highlight was teaching young scientists at the Xerox summer school for organoid chip systems in Tubingen, which is hosted by the center, the 3R center down there. And it was just amazingly, it was literally touching to see so many young, typically PhD students and all of the questions and attitudes they have where they really want to make a difference, and they're asking big, important, challenging questions. And it just gives me so much pleasure and hope to see that there's so many awesome young scientists out there. So that was definitely the highlight of my month, travel-wise.
Right. Now, Thomas, I'm going to ask you the same question, but before we do that, I would like you to give listeners and viewers a bit of your background and also how you became interested in organoids and organ on a chip as well. So would you mind just giving listeners a bit of a background on yourself and what you're currently working on?
Sure. Actually, you guys were just mentioning a few of the stations of my life. I was studying medicine and biochemistry in Tubingen. Exactly there. And I lived 7 years in Italy, working for the European Commission, which was my interruption in this work. And actually, it was there in 2002 that we started working with organoids. We took over a method from Honegger in Switzerland to produce rat brain organoids, which he published 1979 in Nature. So really one of the very early works on this, and which we later humanized. I'm back again, a full-blown academic. I have now 5 affiliations in 3 universities. So a lot to tell, but then it's a broad story. But as you rightly said, my work has been focusing more and more on toxicology, because that's a very strange area. I just turned 61, and most of the methods in toxicology have been introduced when I was not yet born or in kindergarten. It is really time for renewal, and this is my goal. Yeah. So what you characterize as a revolution in toxicology. And I'm trying to do so by technologies, organoids and AI. These are the 2 pillars of our work. And
Brilliant.
that's me.
And, fantastic. And but when I also understand that you've got a very well-known other half as well, because it's on my notes that Miles sent me to say to make sure I mention your other half and how well known. So who is your other and how is she well known?
Yeah, my wife, Lena Smirnova, she is my partner in crime. She is doing now most of the brain organoid work in our team. She has a group of about 20 people working around brain organoids and many clinical applications, autism, some viral infections, really crazy stuff. And I've been focusing over the last 10 years more on AI side of things as the field chief editor of Frontiers in AI and trying to predict properties of substance from structure and the biological profiles. And most recently, we brought this together. We work now on what we call organoid intelligence, OI. So we combine with microelectrode arrays brain organoids and try to show their learning and memory as a fascinating new opportunity.
Fantastic. Well, we may touch upon that then as we carry on our conversation today. Now, one thing I was going to ask you, did you guys actually meet this year at Word Plus 24? Have you actually met and worked together in the past?
Work, not yet, but at least we met. I have to say, for me, it was a bit a seagull maneuver. Fly in, shit on everyone, and fly out.
I must remember that phrase, actually. That's a very good one to remember. Yeah.
I came for my talk, and I had so many appointments. You cannot imagine. Since we started OI, this organoid intelligence things, I gave 88 presentations last year. 17 were keynote lectures at conferences. It was really crazy.
All right. Well, the important thing is that you're getting the word out. That's the important thing, so people start to learn more about it and hopefully take it in.
That's what my PhD supervisor always said: do good things and talk about them.
Yeah, well, what's the point otherwise? No one knows you did it, do they? That's the thing. Anyway, look, today we are going to talk about ethics in using organ on a chip, I should say, and it's a very, very big area to talk about, and it's a hot topic. So, Marianna, maybe we'll start with you. Why is it such an important area to talk about in terms of ethics using organoids, organ on a chip?
Well, I honestly think we're still a bit in the wild west of what we can, what we can't, what we should, what we might do. And I think there's what I've came to the conclusion of working with these organoids is that there's a lot of confusion as into, when a patient gives his or her tissue and we use it and we generate organoids, who has the right then to use these organoids? Are they mine? Are they the patients? Are they the hospitals? Can we use the can we link it to the DNA? Are we allowed to use transcriptomics on it? Can we generate an organ on chip and then, for example, license it for a company to use? I mean, what is the right thing to do and how is it regulated? And although these questions might seem almost like obvious questions to ask, there's no real regulation on it. So, and it's almost on a trial and error base, because with all whenever we apply for ethical approvals or stuff like that, what happens is that we are faced with a list of these questions. And honestly, I always have a really hard time in trying to answer them, and also in trying to decide, well, is the hospital sharing the clinical data? Is the research institute doing it? So, and even within our own research institute and our hospital, we have, in Italian, we say, few ideas and well confused on how, on what the regulations are. And I think it's something that now people start talking about and start asking these questions. So I think it's a very important thing to see and to hear what other people think, but also what other scientists think, because there's also a discrepancy in what an oncologist or a medical doctor might view the output or the data used versus what a scientist might look at it. And I think we should align on these things. So
no, that's fine. Well, look, before we ask Stephen and Thomas their view, one question I've got for you is, where does the patient come into? Because when you take something from a patient, do they sign off permission in terms of you can use this for research then, and how far does that go? I mean, in terms of their permission. Marianna, I was to you.
Yeah, so yes, so we have informed consents that the patients have to sign, and these informed consents are reviewed by the ethical committee. So we have permission of the patient to use the material for research, but if we want to use the material for commercial use, that's another ball game, for example,
Right.
and that is not included in that informed consent. That requires an additional amendment, and the regulation there are very, very strict. I give you an example. If we have a grant, a consortia grant, like for example, so in which we are the providers of so we generate the organoids, but we also provide the organoids to, for example, a company that then does something else with them. This regulation, this providing here has to be anonymized, meaning that we cannot release the information of the patients. We can release the clinical information, but not can't be traced back to the patient.
Sure.
And has to be done in a very regulated manner, meaning that the company can only use it for these things that are written on what
Sure.
we have agreed on, which of course makes sense. But as you can imagine, it slows a lot down processing, because to get these paper signs, it take us anywhere between 6 months to 2 years. So and the reason is it's not regulated. So there's no like, this is what we have to do.
And there's no body who actually is responsible in terms of the regulatory space, in terms of research that could
I think there's the different institutions have different bodies. So there's the ethical body of the hospital, there's the one there's the Unitectra of the university, but I think that we could make an effort to streamline this in a better way and to make the rules much more clear. Even if, for example, I want to share material with you guys, we would have to go through this process of MTAs, CDAs, and of course, which I'm not saying it's not correct. It is absolutely correct to do. It's just that the process has a lot of hiccups because with every institution there is a different set of rules that we have to have. And of course, we are in Switzerland, so we are not part of the EU. So we are our rules are different than the EU rules that are different from the US rules as well. So I don't see this ordeal as to be something easy, but it is something to talk about. Absolutely. Yeah.
Thomas, Stephen, what's your views on this and what are your thoughts on this?
I mean, I would say that as scientists, we typically overlook a lot of the ethical aspects of our work. We have a PhD, a doctorate in philosophy, but we're not philosophers enough to really look into what this means. I mean, my work is a lot about replacing animal testing, so it has a very strong ethical aspect. But it's not that simple. It's not only about avoiding suffering of animals. It is about safety. It's about value decisions. What is economic growth and market access compared to precautionary work. And if you come to the tools we are working with, I'm from Hopkins. Here, the HeLa cells were produced the first human cell line, and we were burned. Yeah, I mean, these cells have been used in, I think, more than 200 patents to develop the polio vaccine. But at some point, the family of Henrietta Lacks came and said, sorry, we had no share of this. Henrietta never gave consent using these cells. And we have now annual lectures and we are honoring her legacy. And this has created a lot of discussion. And now we go steps further. Yeah? Now many cells are from living donors. So we might learn something about you as a donor because we used some of your cells. What is our responsibility? Do we have to tell you? And then science is advancing. I can do my crazy experiments on organ intelligence with cell lines or cells which were frozen decades ago. Nobody has ever thought there could be a material just possibly thinking and might be self-aware. Yeah. So this is there's a bucket of discussions to have.
Yeah, well, I was going to say I was thinking about Henrietta Lacks actually when Marianna was talking about that, because that came into my head about ownership and what happened there. But also, if you're thinking about AI and the speed of AI now discovering things and developing things, and Marianna was talking about 2 years to go through a process of that. At what point do you say, well, actually, we need to stop this now because we haven't got permissions to carry on doing this? AI doesn't have that time limit. It just does it, doesn't it? So it's not going to suddenly stop as to go through the process and say, actually, I need to check this bit before I carry on doing what I'm supposed to be doing. So that brings up another ethical question, doesn't it, in terms of using AI in terms of a lot of the research that you do?
I mean, data privacy is a big thing, more in Europe than elsewhere, but it is still it is at the same time also hindering research. Yeah, the tremendous promise of AI to help with all type of diseases is hindered by access to patient data. Now, if you cannot mine the data, you don't get it. So we need to really find the sweet spot. Against the abuse and while enabling that we take advantage of these technologies.
Yeah, well, it seems to be, as a layperson, I'm not a scientist, obviously, but a bit like if you follow sports and there's the image rights that footballers have, for example, and how far do those images, do they have permission to get revenue back or commercialize their images, because FIFA might have it, the club might have it, someone else might have it, and where does it stop where they can stop making money out of it as well? But you could almost say from a patient's perspective, that's what point does it where they can start to get some return from whatever they're being used for in terms of research and commercialization as well. I mean,
this is the point. When you tell the people, make clear what they are gaining from it, what is in for them, they are tremendously willing to share.
Sure.
But behind their back, just doing it is something which creates suspicion and fear and opens up for the bad actors.
Yeah, definitely. Stephen, what's your view on this?
Well, I'm thinking, I think these are really important discussions. I mean, from the concept of the HeLa cells, and like Thomas says, we have a doctrine philosophy, but but there's not necessarily that much philosophy in that. And as a teacher at a university, and somebody who's been on both sides of both soft and hard science, I used to study psychology before I went into chemistry. It just really motivates me to want to really spread the message on how important it is to have this cross-disciplinary attitude also in the teaching and the schooling of ourselves as researchers, as also young researchers, but also the general public. I mean, science and these questions are just examples of how, molecules and atoms, they can be built up to be so complex things that they're living things, and they can be even models of brains, and you get all these questions. And I think it's just so important that we continue to strive even more to involve humanities and also other fields of social science, etc., into this, so that we can get really good discussions going. I think that cross-disciplinarianism is more important than ever now.
Right. Well, let's take a look now at some of the reasons behind this in terms of evidence-based shift to animal alternatives in research. And I know, Thomas, you've done quite a lot of work. And so what are some of the examples of why another can't represent a human?
Yeah, I mean, perhaps we should quickly clarify what evidence-based means, because
Good point,
most researchers will instantly claim my work is evidence-based, evident. But it is really a term which came out of evidence-based medicine over the last 50 years, where they simply understood nobody can read all of the literature. In PubMed alone, which is a quarter of the biomedical literature, gets 1 million articles per year. So it is not readable. Nobody can understand it all. So then you need somebody or groups or people who are condensing this information to something which is digestible and dense. And so systematic reviews have been developed. And this was really revolutionary. It was no longer the boss, the one who was paid best, who was always right in medicine, but suddenly the one who could refer to such type of condensed evidence is right. And I was fascinated by this as a student postdoc, as a clinical pharmacologist at the time. When I moved to toxicology in 2002, I started what is now called evidence-based toxicology, and I actually have a chair here in Hopkins for evidence-based toxicology, where we're trying to apply the very same approaches of systematic reviews, meta-analysis, risk of bias analysis to toxicological problems. And for me, this is really was an eye-opening step. When you only start to develop criteria, what would you accept as evidence to answer a certain question? You suddenly understand how bad most of science is.
Right.
We do lousy statistics. We are lousy in our reporting. Almost every paper is incomplete in key aspects of the work. And this is something which has changed clinical medicine, and I hope it will also change the preclinical sciences at some point.
Right. Okay. So, I mean, Marianna, Steve, have you got anything to add to that at all?
So I do actually. I find, Thomas, your evaluation of this is quite interesting, in particular the part in which you say that a lot of the scientific papers are incomplete. I completely agree with you on this. I think that this opens another Pandora box that as maybe we should have a podcast on that. And the reason there is that how scientists manage to get grants and move forward, and how they manage to yet go to the next step. I mean, the truth of the matter is that the work is incomplete because we don't have money to complete it, or because we need to publish it to have an evidence base for another grant that we want to write. So the system there is a bit kind of difficult, but that of course is a bit deviating from the ethics that we were discussing again,
Yes.
but yeah.
Yes and
So
no. I mean, I think you're right. The problem is that we are astonishingly little self-critical as scientists because we are trained not to be. You will never write a scientific paper. This is a model with these shortcomings, but I use it. You will always talk, it's the state of the art because you want the next grant, you want to publish, you want an award for your work. So we are always overselling and never in retrospect saying, this paper should be read with a bit of caution, with a grain of salt, as we say, in a few years later. No, it stands in eternity. And so we are really not doing a good job on this. Yeah.
no, but I agree. But it's also, I think, how in a way it is totally our fault in which we do this, but it is also we are forced in a certain direction to do things like this. You know, I mean, it's actually quite interesting because the literature, you know, you were talking about this 1 million papers in PubMed. Of the 1 million papers that are in PubMed, I mean, a big percentage of this is maybe crap, you know, that shouldn't be in PubMed, right? And but how to figure out what is crap and what is not? I mean, and how to mine all of this? It's I think with the advancing of, you know, the technologies and the fastenings of computers and stuff like that, I think our job is a little bit more complicated than what it was a bit before. But you know, it does open many more venues for us to explore, I think.
I have a
You're
have
sitting on the
a-
sidelines quietly, so yes, please
Yeah,
give
I
us your
have-
point of view.
I have a few examples. I mean, you know, we're all afraid of telling a story that isn't going to be a story that people will be interested in, and that can also, you know, shift things towards being you want to tell a more positive story. But sometimes, and also in my own experience in the last years, telling, you know, being critical and telling a negative story, if you want to call it that, you know, reviewers and readers can like that if you write it in the right way. And I'll just give one example. We were describing an approach that we found not to work. It was an analytical chemistry approach that we saw promise in, but it just did not work. And we felt it was important enough to describe it because others could probably learn from that. But we were interested in seeing what the reviewers said. We sent this to, you know, it was a specialty journal in the field, and the first reviewer, I remember the PhD student like burst out into jubilation down the hall, and said, "Oh, you know, minor revision." And the first reviewer had a one-line review, and that was, "A brilliant manuscript tells us the bitter truth." And that was so cool, you know. It was like, so I doubt that those types of stories will make it to the top of the top journals, of course, but you can publish, you know, honest and decent work, I find, and being self-critical. And you know, I think a lot of reviewers and readers will appreciate that, even if you do it written in an honest and constructive way.
Yeah. No, but this is the exception from the rule, which is proving the rule. I had one paper where they congratulate us for our brutal honesty, which I was really led to similar reactions. But you can only do it so often. The body of science is simply patting each other on the back.
Yeah, sure. Now, Thomas, obviously we've talked about what actually is evidence-based. But so going back then, so what are some of the examples of why another can't represent a human?
Sorry, I didn't get it.
What are some examples of why another can't represent a human?
Another card.
Well, maybe someone's misspelt this
Sorry,
question for me. Well, let's go back and think.
Maybe like another animal, or
Yeah,
like
yeah, anyway. Yeah, exactly.
I mean, if we look into mice and rats predict each other by about 60% in toxicological tests.
Yeah.
Which is means simply there's no reason to assume they predict us any better. And indeed, if you look, we do most of the toxicology of drugs when the clinical trials already start. Yeah, this is something most people don't know, but it is for cost and logistical reasons. Most of this is done later. And so you very often can ask, would we have seen what we saw in the first patients and the first volunteers who received this drug in animals? And the result is 43 to 48% of these things are predicted by mice and rats and other rodents. So it is really a very imperfect tool. Yeah, and we should not assume that any other animal test is any better because they are much less standardized. They're not done with the high doses of toxicology, which give you very clear results. Yeah, so I really believe that the most important thing is animal tests are overestimated in what they can tell. They're not useless. They have helped us to clarify quite a few things, but they are overestimated in what they really mean for humans. We're not 70 kilogram rats.
Right. Oh, Marianna, Steve, have you got anything to add to that at all?
Well, I mean, I agree. I mean, we do a lot of I mean, we are still an animal lab to a certain extent. So it's but one of the things that the reason why we focus a lot on animal work is because right now our tools for modeling some aspects are still not there yet. And in particular, the role the immune system, of course, plays in the cancer progression, initiation, in the drug response, and all this. So in a way, we are kind of forced to try to use the more complex live system. I've been working with live animals for the past 20 years, and I honestly think that it's not necessary to keep on doing that. I think that we are going towards the direction that we will be able to replace the animal work that we do with work with organoids, with more complex systems, with organs on chip, and with also maybe parallel organs on chip, right, to match the different systems, and maybe have these cancer cells flow through multiple kinds of organs. I do not believe that the future is still animal work. So, but with this said, my lab still works on with the animals as well. And I think that part of the reason is also because of the culture of the scientists. Meaning, if I submit a paper and I have work that is, for example, on organoids or on cell lines or on models that are not of a higher level, I can reach a certain impact in terms of where I can send it. Whereas the reviewers will come back and say, well, if you do the in vivo experiment and you prove this, and so I've had this back and forth kind of situation several times. And I mean, in some cases, I just said no, and I pulled the paper and went somewhere else. But in other case, I did bow to the request of the reviewer and did the animal experiment and got the paper in the higher impact. And that is, of course, something that I do also to push forward the kind of research I have and to have a certain visibility in the research I have that we do. So I think it's a balance, you know, it's not always necessary to do the animal experiment. That's my take on this.
Well, that's interesting you said that, Marianna, because you've actually preempted a couple of my questions. So I'm going to put that to Thomas and Stephen as well, which is, will we ever stop using research animals? And how can a simple organoid really replace a big animal? I mean, Marianna sort of touched on it already in her answer, but Thomas, Stephen, what are your thoughts on those two questions? Will we ever stop using research animals? And how can a simple organoid replace a big animal?
I mean, I did myself my share of animal experiments. I was in infectious diseases for a while, but I have really learned that we need them less and less because we are getting alternatives which are cheaper, faster, more human relevant. So there's economic reasons. There's also science economy in this. There's a Most of the animal studies we are doing are simply underpowered. We use far too few animals to really have achieve significant results, especially with the many things we are measuring at the same time without correcting statistically for this. I believe that we will continue using animals. For example, like we have to test a drug ultimately in humans, we will have to test veterinary drugs in animals. We will have behavioral studies, which we cannot do in cell culture, though this is all getting smaller and smaller. And we are now working on learning and memory. 4 years ago, I would have said, this is a good example where you need animals. Now we get the first basic things already in cell culture. Yeah, so it's really I think it gets less and less where we need them.
Right. Okay. And in terms of the use of organoids, I mean, do you think that is they will be able to replace a big animal in terms of using a simple organoid in that respect?
Yeah, I mean, what else? I mean, the simple cell culture does not do the trick. Yeah, it does some tricks, but not the trick. No, because I mean, take an organ, take the lung. Yeah, the lung has more than 40 cell types. Yeah, which one will you study? All of them in order, and what is the interplay? So we need really complex systems to understand. The more we want to move into multicellular functionalities, physiology, and this is what most drug development, for example, is about. But on the other hand, the animal experiments are also maxed out. You cannot do much more. Yeah, we can humanize the immune system or a certain cell type, but this is costly, reduces the throughput, and it's still a mouse, yeah, with a few human cells. Yeah. I think the breakthrough is really with these technologies because you can scale them, you can robotize them, and you can more and more plug and play different organs together. I think that with the pressure of getting something meaningful into our hands, these are the technologies of the future.
Fantastic. Steve, anything to add?
Yeah, well, Thomas, I have to ask you regarding, memory, learning, cognition, and so forth. What is your experience with? Is this catching on with in psychology, psychiatry, pedagogics? Do you know how are these fields interacting in these new technologies?
I think this is too early because we're absolutely not talking about higher functions. Yeah, it is really about the machinery for controlling a little video game. Yeah, this is the level where we are at the moment. Pong playing cell cultures. Yeah, so this is. This is where you can show there is an improvement, and we are only at the brink of getting long-term learning established. But the cellular mechanisms we can already start studying. And now we look into disease models. Can we model dementia by taking cells from an Alzheimer patient? Or can we understand which chemicals, which drugs are negatively impacting on cognitive abilities? This is the future, but psychology, you're safe for at least another decade.
Yeah. But do you have you sensed any? I mean, are these do you know if these types of researchers are at all aware of these technologies that are emerging that can be one day used, or is this still kind of in the other department, so to speak?
I mean, when we came up with the concept of organoid intelligence, OI, 18 months ago, we had 600 press hits, yeah, from CNN to BBC, Financial Times, and Wall Street Journal, Forbes, name them. Yeah, everybody was reporting on this. Yeah, but on a level which is not deep scientific. And I have also to say, this was a balloon. We started loudly, and it might implode silently at some point. But it's because it was concept, yeah, a lot of concept showing that the elements are there, and that we now, as a scientific community, can work towards making it happen. And this is what we're doing at the moment. So we're forming a community, and we are trying to help each other, because it takes a lot. It takes a village, yeah, to get memory into a cell culture.
I've got one final question in relation to moving away from animal techniques, and that is, what do you see as the biggest obstacle science faces in adopting non-animal techniques, and what can be done to overcome them? So who'd like to kick that off? Silence.
No, it is my daily work, so I don't want to dominate the discussion here. I mean, I'm directing Centers for Alternatives to Animal Testing, so it's our messaging. We are trying to do exactly this. And I tell you, it is non-scientific reasons. One of the reasons I see is that very few researchers change their methodology. If you are an animal researcher, you have an animal lab, you have people who are taking care of these animals, and you will always find the next project to keep them in job. It takes a lot. Typically a movement to another university that you rethink how you're working. It takes the recruitment of a new chair of a department to really renew and revamp what is taking place. Thomas Kuhn, already in 1970, in his famous book about the nature of scientific revolutions, described that science is not changing linearly, but in waves. He wrote essentially these waves are exactly these time points when somebody retires. And I have to say, in the meantime, we don't change one retirement at the time. Unfortunately, we change one gravestone at the time, because these people continue as the reviewers of our grants and papers and request exactly the experiments as discussed earlier.
Yeah.
Anything to add to by anybody?
So I think that I cannot speak for Europe, but I think in Switzerland they are really trying. So the 3R movement is really trying to I want to say raise awareness in the fact that it is possible to do experiments to be away from the animals, and I think that they are doing a really good job in trying to train the next generation of scientists. Because I think, Thomas, you are right. I mean, we try to, or at least we try to move away from the animals experiment, but in fact, it's the next generation probably that will succeed in this, because we will be the reviewers of that generation, let's say. So, and we know that, let's say I mean, I won't ask as a reviewer for the next animal experiment if they haven't done that in a paper, that's what I mean. I mean, I feel that some of these animals experiments are unnecessary and will not bring an advantage to the study that they are having. That I just think that what we have to do is learn to and design our experiments in a different way, away from the animal experiment, but using the tools that slowly are coming to us. Let's say this is
we have to turn it around. We have to ask for the microphysiological systems, for the organoids. Yeah. So if you come with a mouse experiment, you should ask: is this relevant to humans? Show it in a human complex in vitro system.
I love that. I think that's fantastic. That's a really, really. I think this should be like the highlight of this podcast. Of this fantastic. I think you have said it really, really. You have. I will. Quote you at the next 3R lecture that I give.
Yeah, but there's certainly, you're completely right. There's much more to this. I mean, I'm part of this 3R movement now for 35 years, and we are. It is by increasing the doubt, demonstrating with objective data what we can get and what we can't get from animals.
Yeah,
that's an important one. It is by raising standards, animal welfare standards and others, making it more costly and more difficult to carry out animal experiments. But these are then on better quality and more meaningful. And then it is about demonstrating that the new things are there. Our series of world summits for microphysiological systems, the many workshops and papers are highlighting technological advances that at some point you feel yesterday-ish if you still do the animal experiment, which was first described in 1956.
Yeah. Steve, do you have anything to add?
Yeah, I think this is just a really I'm really loving this discussion, and I think that the shift towards alternatives to animals is also a part of a larger part of society and where we are in the world, because you have the one thing about making sense when it comes to animal models, but you also see the global challenges that we have when it comes to health, pollution, and so forth, and how these models can be applied to addressing these. For example, the chemicals that are floating around in our oceans and in our blood and stuff like that, what is the effect of these on our systems? You can couple developmental biology to environmental chemistry and so forth in these, and other aspects that you can sort of piggyback on in novel sciences is, okay, if you're working with microphysiological systems, then you might also be able to go towards more automation, more miniaturization in systems. Life science industry today has around 5 million tons per plastic consumables that are being wasted. Is this something that we can also piggyback in smaller, more sensible systems? I mean, there's a lot of things that the future needs that you can couple onto each other with this, and I think this will be an important ingredient, because we really don't have any choice. We can't go on like we've been doing, and this is an important part of that.
Yeah. You are so right there. I mean, there's a study from 2019 which shows that 350,000 chemicals have been registered in the 19 most developed countries. 350,000. Let's take the example of cancer. Yeah, because people are fear of chemicals for cancer. Yeah, 3,500 have cancer studies. And why is this? Because a cancer study, first of all, takes about 5 years to complete. So 2 years is the study time, doing all of the histopathology of all of the organs. It is 4 to 5 years. Yeah, it costs $1 million per substance. Yeah, so 350,000 times $1 million, nobody will pay for this. And it takes about 10 kilograms of the chemical to feed 400 rats every day of their life with these chemicals. Tell a chemist to produce 10 kilograms of a chemical. Are you a chemist? Yeah, which is not yet in commercial production. Yeah, nobody can do this. So this is the crazy thing, why the animal is not the answer to some of these problems, and throughput is a big one.
Yeah.
Brilliant. Well, look, we're going to move on to the next question, but before that, for viewers or listeners who don't know what 3 Rs are, Marianna, can you just quickly explain them? Some might be watching this or listening to this going, that's really interesting, but I don't know what 3 Rs are. So would you mind just quickly explaining what that is?
So the 3 Rs are the principle for which we are supposed to use animals. So refinement, reduction, and forgot the third one. Refinement, reduction,
and replacement.
And replacement.
Most important one.
The most important one, yeah, indeed. So the idea is to, whenever we write an animal license, whenever we create an experiment, we should have these in mind. So, and to ask really the questions that also, Thomas was actually bringing up, say, do we really need to do this experiment in the mouse? Can we reduce the amount of animals? Can we use another system? Can we maybe use another system first and then test in the mouse in a smaller group? So that's what this is about. And I must say that it's a world wide movement. I mean, it's not only limited, I think, to the US, to Europe, or to Switzerland. It is really every entity has, every country has its own version of the 3R system. So it's
Thank you for that, Marianna.
Was actually coined as a principle in 1959, so 65 years ago, by Russell and Birch out of the UK. But as you rightly say, it has been adopted by essentially all scientific organizations worldwide as a societal compromise, saying while we continue using animals, we acknowledge the 3R principle, that whenever we can, we get rid out of it or minimize suffering or numbers of animals. It's
Right. Thank you for sharing that, both you, Marianna and Thomas. Now, let's move on to a subject which is close to Thomas's heart, and that's why we're asking the question, which you're here, Thomas. So you wonder why you're getting all the questions, is because you are the guest, so therefore we'd throw all these questions at you. So now we're going to talk about the ethics of AI and potential consciousness of neural organoids chips and organoid intelligence. And for viewers and listeners who don't know, you did an OI publication, Frontiers, which had, as I've been told by Miles, 171,000 views, 25,000 downloads just on the publisher's website. So first question for you related to this is, what exactly is organoid intelligence? When you say that, what do you actually mean?
Very simple. It is a brain organoid coupled through microelectrode arrays to AI.
Right.
So some people are using AI nowadays to try to talk to animals. We're trying to talk to a brain organoid. So the idea is that we can measure what it tries to communicate, that we can use these to have it act, or, for example, on a virtual environment like a simple video game, and then we feed back to the organoid its action, what the result of this action was, and by doing so, trying to optimize their strategy in these type of games. Does not need to be necessarily virtual. We also do experiments with little robots where the brain organoid is in the cell culture. Bluetooth, we have a little robot which is trying to explore the landscape and avoiding objects. So these are the type of experiments which have started. I'm not saying we can already drive a car.
This is very potentially kind of mind-blowing stuff. I was talking to my son about this yesterday too, and it's like, the question is, can you actually grow a miniature brain and make it play a simple video game? Is that like, I mean, is that now, would you say that is that you can actually,
that's what we're doing. And I don't know what the age of your son is. We also wrote a version for 12-year-olds with Frontiers about this.
That is awesome. Maybe that would be an awesome link to share on this, because
well, we're happy to do that. Yeah, we can share that link here with the podcast. So Mary, I've got a question for you. Going back one step though, what really is a brain?
Gee, I don't know. A lot of people don't have one. No,
my wife would say agree with you on that point, actually, about me, but there you go.
Well, what is this is more like a philosophical question, I would say. I mean, what is I would say it's an interconnection of a lot of things that are conscious and unconscious. That is, I think, what a brain might be. I'm not sure I'm not sure I can define what a brain in a dish is. So I think, I think it's a bit like the concept of the heterogeneity of the tumor, meaning you take a part and you mimic it in the dish, or you take, so I think the idea of being able to have so many different components in it to create something that is similar to a brain would be something absolutely fascinating, I would say, and certainly difficult to define. I think that I don't know what your thoughts are, Thomas, on
well, and Steve, I'd like to know what your views are on that. So
yeah, both of you, of course.
Yeah, I'm dying to hear Thomas's thoughts on this. So,
a big problem in this field is that we are using terms which have meaning in everyday life intelligence, or
Yep.
self-awareness, consciousness, all of this, which are far too big and not specified. So one of the papers we wrote actually is about calling for defining these terms for our purpose. Yeah? What is the minimum to call a system intelligence? We are even discussing at the moment experimental ethics, that you can start saying, how complex does a system have to be in order to be called intelligent? So we are working with ethicists in our work, very, very much so, here with the Berman Institute for Bioethics. They're sitting around the table every week when we discuss our experiments, and they come to the lab, and it all gets very humble if they see these tiny little snowflakes of brain organoids, which at the moment, even if these are human neurons, they will not become conscious or whatever. We have less neurons in the standard model than a housefly. Yeah? And what we are feeding them is very abstract signals of a video game as the only input they have, the only thing they can think about. So that they will get conscious, I think, is not very likely. But we are preempting the discussion, because we are also building at the moment already 5 millimeter to 1 centimeter large brain organoids, and 1 centimeter is already 2 mouse brains. Yeah? And if you start giving them access to more complex information, we don't know what is happening. Yeah. So this is why we want the discussion now, the ethical discussion as well, and we are putting out papers. We are serving lay people, just asking them, this is what we are doing. When does it start to feel, ooh, this should perhaps not be done, just to get a base level, yeah? And then we tell them, but we do this in order to find new drugs for Alzheimer. Is this changing your view? And so we're really trying to explore what a general population would say, because as scientists, we have more and more to live in society. We have to, not only with the aspect of doing animal experiments, we are controlled by people, and we are living from taxpayers' money. So we should better consider what they feel about our work. Yeah.
Well, that's interesting. I mean, Steve, have you got anything to add to that before I ask the next one?
Yeah, I have to, I have to ask, Thomas, in about 1980, there was a movie with Harrison Ford called Blade Runner. And it was in the future, and they had these humanoids who were working, and then they turned against civilization. Of course, it's a fun science fiction movie. But I mean, while we're on amazingly interesting topics and how far it can go, do you think that we can one day in the future grow humanoids, like full-on humans that are, grown humans? This is, of course, a very unfair question because it's so far, but I would be very interested to hear what you think.
I mean, I think probably it's easier to in a very traditional way to grow humanoids, which are, let's say, have reduced brain functions and can serve as slaves for us. Yeah, we don't need high tech for this. If we wanted to do this, our work is really more about creating a brain and combining it with in silico type of computers, and this goes really, for me, into drug development and in finding the things which are damaging to the brain with more sensitivity. For many of the engineers we are working with, it's about biocomputing, yeah, because the brain is a fantastic computer. It was only in 2022, 2 years ago, that the first supercomputer outperformed a single human brain in its computational capacity. And this was a $600 million investment on 680 square meter of installation. So you can think, this is what we are carrying in one brain. Yeah.
Yeah.
If we understand how the brain becomes such an efficient computer, we might benefit from this. And it is outperforming the computer still in a few tasks. So intuitive thinking, continuous learning. Yeah. Our computer programs, if they want to learn something new, you have to rerun the model. And this is These are things which are really we want to learn, and then we can perhaps build better computers just on our understanding of how the brain does the trick.
Yeah. Anybody else want to add anything before I move on to the next one? Because Thomas, you're such a
So-
fascinating. Everyone's got questions for you. This is the thing.
Yeah, so I understand what you're saying, and I do agree with it, but I somehow I have more so the study of the brain, I find it applicable or to diseases indeed like Alzheimer, and also improvement of computers, supercomputers, whatever. But I find that the potential of the technology of the organ creating in a dish more towards something that ends up in towards the transplantation kind of medicine, in which we would be able to grow, for example, a bladder or a kidney or whatever. I mean, I wouldn't go replacing somebody's brain, obviously does not seem to be feasible, or not, at least now. But what I see more the technology towards something applicable in this kind of respect. So like, for example, if a person is on dialysis, right, but we could replace the kidney, or we would be able to step forward in that kind of medicine. And the study I see on the brain, I see it as extremely fascinating, but applicable more to computer driven kind of applications in that respect. So
I would not be sure about the future.
No,
Because I
course
mean,
not.
imagine the following: you have a stroke, areas of your brain are gone. I take some of your skin cells or blood cells, produce from your own cells neurons, brain material. People in Stanford, in Pascal's group, have already shown that these organoids can be implanted into rodents and integrate functionally. And then with the plasticity of the brain, you could get biomass of brain. Yeah.
No, but that I think is different than creating a brain in a dish. So
At some point it is in the dish and then it's implanted. Yeah. So it's
no.
it is.
So what I mean is that what you are describing is what I think I would define as healing within the body, right?
Yeah.
So you add like also in the example of a person that has a myocardial infarct, for example, the tissue is dead and part of the heart doesn't beat anymore, so it creates a necrotic area. And maybe one day we would be able to inject, for example, or to implant those organoids there that can have the heart remodel and reheal within, just in the same way that you're describing the brain. I find that extremely fascinating, and indeed a direction that I think we will pursue, and we are, and a lot of people are pursuing, actually. What I'm saying is that I think that the complexity of creating an organ like the brain in a dish, in its total, that I think is more complex, I would say, in a way, and definitely a bit further out in achievement, I think. Not that's what I mean. Yeah.
No, I mean, if we are in the visionary field, I mean, regenerative medicine is certainly an enormous future, yeah, and stem cell technologies open up for this. At this moment, we typically produce some baby cells, so not completely differentiated cells, and we hope they find their target or stick where we inject them. But if we have more already differentiated structures, yeah, they might be more directed. There might be patches which don't swim away. So you could imagine that this is really a path forward. But I agree, it is far, and it's not my area of work. So
All right. Well, I've got to go, but I appreciate time is moving on. We've been talking for quite a long time already, and I have still got one other set of questions to do. So before we do that, I'm going to jump on for my last question in this area, which is, can we use brain organoids today for testing drugs or other stimuli? So is that
Yes, we
possible?
do. I mean, this is the bread and butter business we are doing. We are using them. We can show that toxicants which are known to hinder brain development are effective here. We even do gene environment interactions. So by introducing risk genes for autism and showing them that they get more sensitive for certain pesticides. We even on this basis have become part of a 175,000 children study in an autism excellence center, where they try to find these gene environment interactions, and we are trying to model them in the brain organoids. Yeah. And once you have the disease model, you can look into, is there something which can redirect the brain to become fully functional? The limit is the sky. Yeah.
Right, brilliant. Right, now let's move on to ethics of patient samples. We started, obviously, this is all about ethics. Let's talk about licensing, IP derivatives, and consent. So this is aimed at you, Marianna. What can go wrong when publishing a patient sample? Who owns the right to the DNA, for example?
Oh God, I mean, before I get myself in any kind of trouble here, I mean, there's a million rules that we have to follow when we publish DNA samples, and they have to be the sequences have to be deposited in repositories, and they have to be they can be public available, or they can be protected. It depends on what the journal requires or requests. And I think I'm not entirely sure, but I think that nowadays IP protections on DNA are not possible anymore, so you cannot do that anymore. So it's a gene is a gene, so you cannot protect that. I believe that IPs that are related to findings with patient information are getting harder to get, and the reason is, let's say I identify a signature of whatever, of resistance, right? And I identify it through a code or something like that that I have created, or I cannot protect the code, because then if you come in and you use the code and you change parts of that, then the original code is not protected anymore. So I think we have a bit of a gray zone. On the other hand, I do believe that this does favor better the interaction among scientists, meaning that I don't have to be so afraid of putting something out there because somebody's going to steal it, because anyways, if I publish it, it will be made available for everybody. I mean, I make it a point of publishing all of the things that we publish as open access, so that everybody can have access to it. But yeah, I find it difficult to answer your question, but it is because there's no one answer to this question that you're asking. It's every country does it still in a very different way, I think, how we relate to IPs.
Before Thomas and Steve jump in here, one other question related to this, though, is, can a patient IP their own DNA, and is that ethical?
The answer to that is that I don't know if
Right,
that's,
okay.
I don't know if I know that a patient can decide to not sign an informed consent, and therefore none of the information that comes from that patient, medical, DNA, RNA, whatever, can be used. As a matter of fact, when we receive tissue from the clinic, before we touch the tissue, we verify that there is or not an informed consent. If there is no informed consent, so if the patient has not signed that informed consent, we discard the tissue.
Right.
because we are not allowed even to store it in our freezer. So it's not, it means that the patient said no. So it's so the patient is in charge of its tissue, but I don't know if the patient can IP its tissue. That I'm not sure.
Right. Thomas, have you got any comments on this or any views on this?
Yeah, absolutely. I mean, first of all, I think that we are have high ethical standards throughout scientific research. Everything is done according to these standards, but science is developing so quickly, and cells are there to stay in our freezers, and we always have to review: is this still covered? Is the intent of the patient really honored with the new type of research we are doing? For example, it is no problem. We see this with 23andMe and others who suddenly find serial killers of the past because their relatives have given their DNA and allowed that scientific research can be carried out with this material. So you can really identify people nowadays based on the sequence of their genes. This was certainly not intended when some people gave consent to their cells being produced. Can you then put this into the open? And these are very important questions. The IP question is, however, also a bit outdated. Patents came in when we had very long cycles of lifetime of products. It is a 20-year process. Yeah? And the deal was, you tell the world how you do it, instead of having a secret in your manufacturing. And in exchange, you get a period where you can use it only, and then everybody can use it because it's well known. Nowadays, science is changing so quickly that patents on software typically make no sense. Patents on most biological things make no sense. They're only done for the pride of the researcher to add to his publication list also some patents, or for investors, because they live in the illusion that because the biotech owns some patents, they will be able to do exclusively something. Patents have become more hindering than enabling in recent time. Everything is plastered with patents, and you have no freedom to act. I think we have to rethink the system for biotech and computational approaches to give a different way of acknowledgement of ownership. Yeah,
that's interesting. Steve, what's your thoughts?
Well, this is a very, I think this is a very topical discussion. I'm thinking, so Thomas, if I was going to play devil's advocate regarding the IP and so forth, what about like a drug company who spent billions on a product and wants to be the only one who makes money on that, and they want to protect it with a patent? How would you argue that is also hurting the science in that part?
No, this is much less so, because this is a substance-specific thing. Yeah? So we don't have a problem with your third generation, fifth generation aspirin is going to be yours for a while until to recuperate the money you invested, which is more than 2 billion on average. Yeah, so it's really a lot of money, and the enterprise would not work without protection. But we have a lot of now process patents, because you cannot patent genes, so you patent what you do with the gene, and these are things where it is typically not difficult to circumvent certain steps, and then you have all these discussions: is this now a derivative? Is it dependent on the primary patent? It is almost impossible to find all of the different patents you might possibly breach, and that's where it really gets murky. Yeah? And I think we need to find a way of not spending millions every university on protecting stuff which is only hindering work of others, but it's not enabling something as it originally was intended. Yeah.
No, that's great.
Interesting.
No, well, thank you. Look, that's pretty much covered all the topics that we wanted to talk about today, and we've been talking for quite a long time, but time has flown. So I'm going to conclude now by just asking you, like we did last month, and Thomas, you can join us in this little conversation about what your plans are for the coming month. So Marianna, where can people meet you in person, and what are you going to be learning about in the next month or so?
The next month, a couple of months, until the end of November, I will be in Bern. So I will try to actually get some work done on.
Well, that's good to hear. All right. And Stephen, what about you?
Yeah, well, after a little trip to Liverpool this weekend, I'm talking at a conference there, and I'm going to try to see some, like I mentioned last time, some Beatles memorabilia stuff. But other than that, I'm going to be hanging out in Oslo, Norway. So if anybody interested in organoids wants to come is in Oslo, then drop me an email or whatever.
All right. And Thomas, how many more talks are you doing in the next 2 months? You've done 70 already in the last year or so. You say, so how many more you got to do in the next couple of months?
I have 2 more today. So and I know this. I'm at the moment a global citizen, either by virtual contributions like this one or by in-person ones. There's so much to do. But I was waiting 30 years of my life that people want to hear me. So,
You can't complain that.
I think it is important that our messages at the moment are reaching an audience as we have not seen before. Microphysiological systems, organoids, AI, organoid intelligence, but also other topics like green chemistry, toxicology, evidence-based things. All of them are flourishing at the moment. So I'm a happy guy.
You're in demand, Thomas. That's what you're trying to say. So it was good to hear. Well, look, Myra's actually sent me some questions for you, but I'm going to ask these questions to all of you. Just very quick fire ones. Just alternative multiple choice. So I'm going to start with you, Marianna. Beer or wine?
Beer or wine? Wine.
Thomas?
Wine.
Steve?
This weekend, beer.
All right. Marianna, pizza or pasta?
Pasta.
Thomas?
Pizza.
Stephen?
Pasta.
You had to think about it. Marianna, guitar or drums?
Drums.
Thomas?
Guitar.
Oh, what are you getting, Steve?
Well, we know the answer there, guitar. There you go. And finally, Marianna, rock music or classical?
Rock music.
Thomas?
Rock.
Stephen?
Rolling Stones, Doors, all the Jimi Hendrix, all that stuff.
So there you go, listeners. If you've heard that, you know how to start a conversation. If you don't want to talk about organoids straight away, you can talk about whoever you're meeting. You know what to start the conversation about. Look, Marianna, Stephen, Thomas, it's been lovely to see you again. Thomas, thank you very much for being our guest today. It's been really interesting. So viewers and listeners, I hope you've enjoyed this. If you have, make sure to like and subscribe at your favorite podcast and YouTube channel for future episodes. And please let Marianna, Stephen, Thomas, and myself with any feedback. In fact, I forgot to ask you, Marianna, Stephen, did you get any feedback to the podcast that we did last month? And did anybody comment?
I did actually. A lot of people heard. I got a lot of emails by people saying, "Oh, there's a podcast. You're on it."
Good. I'm glad to hear it. And so hopefully, Thomas, I mean, you mostly get millions of emails every day anyway. So we'll hopefully add to those though about the podcast. So look, if you have got any topics that you'd like us to cover in future podcasts, please feel free to get in touch with us with the comments below the podcast, or message us on LinkedIn or via email, or however you like to do it. We'd love to cover those topics in future episodes. And if you haven't registered yet for Word Plus 2025, which is on February the 11th or 13th, near Cambridge next year, make sure you do. The link for that will be above this podcast as well. So all of you, it's been lovely to see you all again. Thomas, it's been lovely to meet you for the first time. It's been a fascinating discussion, genuinely learning all about organoids and the brain. So I look forward to learning more about this, both in future podcasts and meeting you all in person in not too distant future. So viewers and listeners, thank you very much. Until next time, stay well and stay safe. Bye-bye from all of us. Bye-bye from Marianna.
Yes.
Thomas.
Bye-bye.
And Stephen. And from me. Bye-bye.
Yeah.
And that's a wrap, everybody. So hopefully you enjoyed it and it was all good.
Yeah, was good.
Great.
Fantastic. Well, thank you.
Really
very
awesome,
much.
Thomas. Thanks so much. This was